Good morning, everyone. My name is Daniel Amankwa, and I'm mentioning the name because when you look at the agenda, there is Dr. Sintiki Tafa Ugbe, who is the Director for Humanitarian and Social Affairs, who is scheduled to give the welcome remarks. But she has been given another assignment. That is the next item on the agenda. So she asked me to go ahead and stand in her shoes and welcome you all to this very important occasion. It's an important occasion for the ECOWAS Commission because we are talking about one of the sophisticated, dynamic issues confronting all of us. And we are very, very happy that today we have gathered here to look at what we call WENDU. WENDU is the West African Epidemiology Network on Drug Use Report 2020 to 2022. So on behalf of my director and the commissioner who will come in later, I welcome all of you to this lunch. And as you might have learned from the agenda, we are launching 2 documents, even though they are all from the same source. The first one is the policy brief and the WENDU report, which is a very bulky document. So those of us who want to go into details and look at the whole report, you can do so. And having said that, let me just take some few minutes to talk about the very important personalities that we have at the high table here, so that from there, I will yield the floor to Dr. Sintiki, who will read the statement of the ECOWAS Commission, ECOWAS Commissioner for Development and Social Affairs. I will start from my left. We have Dr. And if I say I'm starting from my left, it's not according to a seniority or position or that, but just as the seating arrangement is. As we go along, the proper introduction of some of the dignitaries will be given. What I'm doing is just a preliminary introduction of the high table, so that when anybody is speaking, you know the one who is speaking. So we have Dr. Annie Christian, who has been one of the pillars of this WENDU launch from the INAT. INAT is a project at the ISS. And then myself, Daniel Amankwa, the principal program officer, who is in charge of drug prevention and control at the ECOWAS Commission. We are privileged to have the Director General of the Narcotics Control Commission, and who is our who will deliver the keynote address, as you see on the agenda. Then we have a representative of one of the pillars of WENDU. It was a pillars of WENDU. WENDU started in 2018 by the ECOWAS Commission, but until 2016, it had not taken off until the EU came in and supported the ECOWAS Commission. So today we have the representative of the EU, the head of the governance and security session at the EU delegation to Ghana. And we are happy to have her here. Then, last but not the least, I mentioned INACT. We have the head here. Eric is the head of the INACT at the Institute of Security Studies. So, ladies and gentlemen, these are the privileged high table that we have today, and we are grateful. And I must also say that all of us who have met here today, if my director had been here, she would have liked to mention some of you specifically. But since she's not here, I will just add all of you together and say that you are very much welcome. So if I don't mention your name, it's okay. All of you are welcome, and thank you very much. So having done that, I want to find out if the director is online. So kindly check for us so that I yield the floor to Dr. Sintiki. Dr. Sintiki is the director for humanitarian and social affairs, and commitment to drug prevention and control in West Africa is unraveled. I joined ECOWAS in 2016 to meet her, and I always admire her, the strength, the commitment. So if Dr. Sintiki is online, I will yield the floor, and Dr. Sintiki will read the statement of Professor Fatou Sousa, who is the Commissioner for Human Development and Social Affairs. So, Director, I yield the floor. You can project, that would be good. You know, the woes of technology, we have to do with it like that. You will not get everything smoothly sometimes, but eventually you will get it. So IT, anytime data is ready, let's know. And then you project her and we see her face. Okay, so I was talking about the WENDU that is started 2013 by the ECOWAS Commission, and then EU came in and assisted in terms of funding, and then we had the UNODC who also assisted in the WENDU project by giving us technical support. So between 2016 and 2019, we had ECOWAS Commission, UNODC, who were implementing the WENDU project. And the EU was giving us the funding, the support. And then when it ended in 2019, ECOWAS took over. In fact, that was part of the plan that the WENDU should be sustained, because what is the use if we start and then somewhere in the middle we leave it? So WENDU continued after 2019, and the reports we had the first one 24, we had the first one 2018, but it covered 2014 to 2017. And then we had another report, which was the 2018 and 2019 report. So you could see that the first one, 2014 to 2017, 14, 15, 16, 17, I think that was 4 years combined. And then we have 19, 20, 2 years combined. And then we had, we have now the 2020 to 2022. In fact, our intention was to have the reports every year so that the data will be more current. But we are happy to say this also helps us to be able to compare the previous years with the current year. So we have 2020, 2021, 2022, meaning when you pick one report, you'll be able to look at the figures of 2022, 2020, and 2021 and 2022, and you can do your own comparison. And that is also a good idea. So not having it yearly really is not a bad thing, because some may even
take out this volume. Okay.
Okay, thank you. Welcome, Director.
Yes. I can't hear them.
Oh, Director, good morning. Can you hear me?
Yes, I can hear you.
Okay, and you are live, but we can hear you and see you. So
okay.
Thank you so much for taking time to join us.
Yes.
I'll give the floor now. Thank you.
Thank you for the opportunity to deliver these remarks on behalf of the Commissioner Human Development and Social Affairs of the ECOWAS Commission. Madam Chairperson, the representative of the Federal Republic of Nigeria as the chair of ECOWAS, the Director General of the Narcotics Control Commission, and other heads of drug law enforcement agencies present in Ghana and those online, the program head, Enhancing Africa's Response to Transnational Organized Crime, ENACT, at the Institute for Security Studies, Your Excellencies, all present online, the ECOWAS special representatives, the representatives of the African Union, the West African Health Organization, Interpol, and the UNODC, our cherished development partners, of course, the European Union, the Bureau for International Narcotics and Law Enforcement Affairs of the United States Department of State, our West African Epidemiology Network on Drug Use focal points all over West Africa, the representative of the Network for West African Research on Organized Crime, and of course, the West African Network of Civil Society and Substance Abuse, our hardworking resource persons, all online participants, media, distinguished ladies and gentlemen, good morning. I'm glad to welcome you to the launch of the 2020-22 West African Epidemiology Network on Drug Use report. Permit me to take this opportunity to thank the WENDU focal points in our member states for their continuous efforts in getting the raw data used for this report. We at the ECOWAS Commission very much appreciate your dedication, especially taking into the consideration that you carry out this responsibility diligently. We also appreciate the work that our various resource persons and the ECOWAS staff do to ensure that the reports are prepared for validation and eventual publication to support policy advocacy, programming, and action at the national and community levels. I take this opportunity also to thank the European Union and the UNODC, who supported the West African Epidemiology Project between 2016 and 2019. Even though this WENDU report we are about launching today is solely funded by the ECOWAS budgetary resources and technical expertise of ECOWAS and the member states, ECOWAS remains grateful to the EU and the UNODC for the financial and technical support assistance provided under the EU support to ECOWAS for the implementation of the ECOWAS Drug Action Plan. The EU and the UNOD support ended in November 2019. However, as anticipated under the ECOWAS EU drug project, the ECOWAS Commission has ensured the sustainability of the West African Epidemiology Network on Drug Use Project and has indeed improved upon it. Today's 2020 to 2022 launch is an indication that the sustainability measures put in place by ECOWAS Commission are yielding the desired results and that the WENDU project has come to stay. Ladies and gentlemen, the current WENDU report comes with a policy brief. On this note, I must commend the implementers of the Enhancing African Response to Transnational Organized Crime project at the Institute for Security Studies. ENACT provided ECOWAS Commission with all the technical support for the development of the policy brief entitled Towards Effective Solutions, Managing Illicit Drug Use and Supply in West Africa. As ECOWAS Commission, we realize that the WENDU report is very, very bulky. Not every policymaker has the time to go through a bulky report. So this year, we have been innovative, and with the support of INAT, ISS, we have produced a policy brief that will really highlight the issues that came out from the 2020 to 2022 WENDU drug report. In addition, ENACT and ISS have also supported us, not only in the development of the policy brief, but in ensuring that we have a physical and a virtual launch of the WENDU report, largely funded by ENACT. The ECOWAS Commission is therefore grateful for this support and looks forward for future collaboration, not only for the WENDU project, but also in the areas of addressing transnational organized crime in ECOWAS member states. You recall that this 2020 to 2022 WENDU report is the third series of the reports that we are producing, with the assistance of WENDU focal points in all the 15 member states, partners and resource persons. The first WENDU report was launched in 2014 to 2017. Then we had the 2018 to 2019 WENDU report. This third report covers 2020 to 2022 report. As you recall, because of the COVID and 2020 and 2021, of course, we've had challenges, but we remain committed and we have produced this report. It is our plan and our commitment to ensure that subsequent reports are published yearly, and with the support of our ECOWAS focal points, we know this is possible. A credible and current WENDU report is crucial to improving evidence-based drug prevention and control activities, both at the national and regional levels. In this regard, the ECOWAS Commission puts a high importance on the collection, collation, and validation of the WENDU data before it is published. I must let you know that the previous WENDU reports are not just the reports that we produce and put on the shelf. These reports have influenced and informed the ECOWAS Commission to identify some of the gaps in drug prevention and control in our region. And based on these gaps and efforts, we have made some considerable priorities and attach our budget to support implementation of some of the priority challenges that we have identified. As you may be aware, in the 2018 and 2019 WENDU report identified gaps in the drug treatment facilities in the region. In this regard, ECOWAS Commission is supporting member states to strengthen their infrastructure for drug treatment within the region. Due to limited budgetary allocations, we have so far been providing this assistance in phases. As at November 2023, 7 countries located in Togo, Sierra Leone, Lagos and Sokoto in Nigeria, Burkina Faso, Ghana, and of course, Kano in Nigeria have received ECOWAS support, and work is ongoing to complete some of the projects that are ongoing. The 8 drug treatment centers, which is located in Niger, was nearing completion when the coup occurred, thereby slowing down the work. In addition to the 8 centers, 4 more centers located in the Gambia, Cote d'Ivoire, Enugu, and Liberia are undergoing project procurement process to enable us support their centers. And in the coming year, we have budgeted for 4 additional member states to support. The ECOWAS Commission support for the drug treatment and rehabilitation centers in West Africa is also tied to the work that we do under the Universal Prevention and Treatment Curriculum trainings going on under the Colombo Plan, which most of you are familiar with. The UPC and the UTC training, that is the training on prevention and the training on treatment, are aimed at building capacities of drug demand reduction professionals to be able to deliver evidence-based care for people with drug use disorder. Talking about the UPC, that is the prevention, the UTC training, that is the treatment training, I must commend the Global Drug Demand Reduction Program's division of the Bureau of International Narcotics and Law Enforcement Affairs of the United States Department of State for their collaboration with the ECOWAS Commission. Under the Colombo Plan training as of today, about 200 professionals have been trained as international certified addiction professionals. The trainer capacity building aims at enhancing skills of selected professionals to participate in the coordinated and unified response to the health and social problems related to substance abuse disorder through effective professional health care for people with drug use disorders in the ECOWAS region. Therefore, we are grateful to the Colombo Plan. Ladies and gentlemen, reliable data is very important for policy and evidence-based training, programming, and advocacy at all levels. As we launch the policy brief, as we launch the 2020 to 2022 report, we hope that you use the information to strengthen your programming at the national level. We also state that as we launch this report, that our partners will continue to support our member state based on the recommendations of this report. With this brief remark, therefore, the ECOWAS Commission wish each and every one of us physically in Ghana and online a successful launching, and we look forward to working with our member state to address some of the recommendations as clearly stated succinctly in the policy brief. Merci, obrigado, all the best. Thank you.
Thank you very much, Dr. Sintiki. as I said, Dr. Sintiki's commitment when it comes to drug prevention and drug control is unrivaled, and to me, is one of the people we must cherish so much in the sub-region when it comes to fighting drug prevention, the drug menace. Thank you very much, Director, for that excellent remarks on behalf of the Commissioner, Professor Fatuso, sir. Before I yield the floor to the next speaker, let me quickly say that this program is online and we have so many people. If you recall, when the director was speaking, he mentioned a lot of networks and a lot of people who are not here in this room with us, but they are online with us. And I checked the WhatsApp groups and I heard people asking about interpretation and all that. So I want to say that we have interpretation for the 3 ECOWAS languages, English, French, Portuguese. So as when you go to the Zoom, there are some procedures. I hope that you'll be able to join and then participate fully. Thank you so much again. And let me quickly yield the floor to the head of the governance and security section at the EU delegation in Ghana for her statement. Thank you very much.
Yeah. Thank you very much. Thank you. Director General of the Narcotics Control Commission of Ghana, Dr. Sintiki Tarfa Ugba, Director for Humanitarian and Social Affairs at ECOWAS, any Christian from the INACT at ISS, Eric Pelser, Program for the INACT Project at the Institute of Security Studies, Daniel Amanaku, responsible for the drug control in ECOWAS, dear representatives who are online of the national focal points of the WENDU, dear participants here present in the room. Allow me, first of all, to thank you, to thank ECOWAS, and to thank the colleagues of ENACT and ISS to allow the European Union delegation to be here and to be able to address the audience. We are here for the launch of the WENDU. We heard that this is the 3rd report, the WENDU, the West African Epidemiology Network on Drug Use report is the 3rd one. And we heard that Dr. Sintiki, the Director for Humanitarian and Social Affairs in ECOWAS, highlighting the fact that ECOWAS had received the support of the European Union that I represent. I sit here in Accra at the delegation, and that this report, this 3rd report has been elaborated by the ECOWAS, expressing the importance that ECOWAS Commission attribute to the studies on drug trafficking and drug use and abuse, and how the European Union enters into this. From 2 different angles, the overall support that the European Union provides to the ECOWAS in many different fields of activities. Here in Ghana, we participate in many different events on projects which see the European Union and the ECOWAS in close partnerships for different challenges that the member states of ECOWAS, including Ghana, are facing. And the second angle is because in the policy brief that has been elaborated on the basis of the WENDU, the project ENACT, which is the project enhancing the African capacity to respond more effectively to transnational organized crime, is a project financed by the European Union. So the ENACT project joined ECOWAS in this common goal of releasing and launching the WENDU report 2020-2022 and to adopt this policy briefing in order to inform the policies in this sector based on the data and the evidence collected and presented in the WENDU report. So let me make a reference to the importance of the drug areas. Let me start by mentioning that West Africa emerged in the mid-2000s as a transit hub in the international illicit drug trade, and the consequent surge in the quantity of drug transiting through this region have been well documented. And at the same time, the dramatic growth in domestic drug consumption in the countries of the region and the challenges faced by the expanding population of people who use drugs are far less reported. This has been the case mainly because of the lack before of the reliable data. So the importance of the WENDU reports and the commitment of the network, of the epidemiology network with the national focal points reside precisely in the research done in order to collect proper data and to inform the policy making and the advocacy on reliable data. At the same time, we have to remember that the absence of a clear overview of the phenomenon, of the drug phenomenon, has been an obstacle to effectively addressing the growing phenomenon of the domestic drug use. And this has also meant that for quite a while, policy solutions have not been formulated and implemented to help the drug users. This is the reason why this situation in which there were a lack in clear overview of the situation and the lack of proper data has been addressed at the policy level by ECOWAS through the adoption of what also Dr. Sintiki mentioned and referred to, the ECOWAS Regional Drug Action Plan. And the report that you will be discussing and the policy brief that you will be adopting represent a clear result and the follow-up given and provided to the ECOWAS action plan. The WENDU report highlights the latest estimates and trends on drug abuse and drug supply, as well as also the trafficking in substandard and falsified medicines. Through making available relevant statistical data, the report helps to inform tailored responses in order to address the social health and economic consequences of the substance abuse and illicit drug trafficking in West Africa. And this is a major milestone and achievement for which the EU would like to extend its congratulations to all the different researchers and partners involved in the elaboration of the report, particularly the national focal point of the WENDU and all the researchers which allowed the preparation of the two documents. As I mentioned at the beginning, I mentioned at the beginning that the ENACT project is involved in this common endeavor. The ENACT project is a EU-financed African continent-wide program implemented by the Institute for Security Studies and the Global Initiative Against Transnational Organized Crime and Interpol. From its start in 2016, the ENACT project has published highly relevant and very accessible reports on a range of transnational organized crime issues and challenges affecting the continent today. Also, the drug trafficking, the illicit drug trafficking and the drug abuse belong to the efforts not only carried out by ECOWAS, but also by the European Union, both in the ECOWAS region and in Africa, in the field of transnational organized crime. The reports that ENACT has been able to elaborate cover a range of illicit markets, including also the maritime crime, the cattle rustling, and the trafficking in small arms and light weapons, which destabilize the different economies and also the social and the health issues, tissues and social tissues in the countries. ENACT has also elaborated an organized crime index, which is a major output of the ENACT project. I would also encourage you and all the participants online to check in the ENACT website the different reports that have been elaborated beyond those related to the drug, because there are very interesting issues in relations to the different transnational organized crime reports that the European Union has contributed to finance through the work of the researchers of ENACT. The analysis and the insights generated by this project, this particular project on enhancing the capacity in the African continent to tackle the issues of transnational organized crime are useful because we heard it before also by the director in the Humanitarian and Social Affairs Department in ECOWAS. They can inform policy making based on data and evidence. And the same is today, no, with this WENDU report and the policy brief that we are here to launch. Let me just refer that on one side, the research and the advocacy activities are part of ENACT project, are part also of other projects that we support in West Africa. So the same member states of and member countries of the ECOWAS, with another project on transnational organized crime, which covers many different illicit trafficking, which is the OCVAR T project, for which we will be having other events in the coming day. So this is just to express the gratefulness for from the European Union to be called to be here today to this lunch, and to express how this project is inserted in a broader framework of support that the European Union provides in the field of research and in the field of policy making, in the fight and common fight of the transnational organized crime. So I wish you fruitful debates and exchanges around the WENDU report and the policy brief, and I thank you very much.
Thank you very much. And let me just reiterate that the EU's presence and support is very much appreciated. And as you just said, we have the OCVAR program, that is Organized Crime West Africa Trafficking, which is supported by the German government and the EU. And let me take the opportunity to say that tomorrow, 28th to 29th, the program will continue. There are some sessions here at the same venue here going on, and we will focus on the OCVAR project. Thank you so much. And let me now yield the floor to the Director General for the keynote address. Thank you.
The chairman of the ECOWAS Commission, His Excellency the President of the Federal Republic of Nigeria, Bola Ahmed Tinubu, the President of the ECOWAS Commission, Omar Toure, the Commissioner for Human Development and Social Affairs of the ECOWAS Commission, Professor Fatou Sa, the Commissioner for Political Affairs, Peace and Security, Ambassador Abdel Fattah Musa, the Director, Humanitarian and Social Affairs of the ECOWAS Commission, Dr. Sintiki Tafa Ube, the Head of the Governance and Security Section at the EU Delegation to Ghana, Anna Lisi, Program Head, Enhancing Africa's Response to Transnational Organized Crime, INACT, at the Institute of Security Studies, Mr. Eric Palsa, the Director, Drug Demand Reduction of the Narcotics Control Commission of Ghana, Mrs. Judy Mensah, the Acting Director of Research, Policy and Planning, Narcotics Control Commission of Ghana, Mr. Kumsin, the Acting Director of the Public Affairs and International Affairs of the Ghana Narcotics Control Commission, NODC, Interpol, WHO, ISS, and INL. WENDU focal points, WANAC, WANSA, resource person and researchers, virtual participants, the press, interpreters, ladies and gentlemen, all other protocol duly observed. Good morning. It is my distinct honor and privilege to bring you greetings from His Excellency, the President of the Republic of Ghana, Nana Addo Dankwa Akufo-Addo, and my Sector Minister of the Interior and Member of Parliament for Nandom, Honorable Let me express my deepest appreciation and thanks to ECOWAS Commission for selecting Accra, Ghana as the preferred venue for this launch. Permit me to also express appreciation to member states, WENDU focal points, and especially INACT as the sponsor partner for their commitment and hard work towards the completion of this report. I am reminded of the collective effort and commitment that has gone into compilation and analysis of the WENDU report. The WENDU report serves as a compass guiding through the complex landscape of drug-related issues in West Africa. It provides a comprehensive overview of the evolving patterns in drug supply and usage, empowering us to make informed decisions and implement effective strategies. The report also highlights and discusses essential and prominent results from the 2020-2022 WENDU data for programming, policy, and advocacy to address social and human issues that seeks to address the economic consequences of substance abuse and illicit drug trafficking in West Africa, as well as identify and disseminate policy brief, key findings, and recommendations to ECOWAS member states and Mauritania to effectively combat drug demand and illicit drug supply in the region. Ladies and gentlemen, we have convened here to witness the release of the 3rd edition of the Regional Report on Illegal Drug Trafficking and Drug Use in West Africa, where the 2020 WENDU report will be made available for policymakers in formulating policies which will address the social, health, and economic repercussions of substance misuse and illicit drug trafficking in West Africa. This report launch will also discuss and uncover the significant work done by the West African Epidemiology Network on drug use, an ECOWAS project aimed at boosting the knowledge base of policymakers in the ECOWAS member states and Mauritania. It is worth noting that data collection from each site relating to selected aspects of drug demand and supply, primarily the WENDU's national focal points, will also help to identify changes in drug use patterns and emerging trends, as well as communicate with the respective agencies and organizations in charge of addressing drug substance problems that directly benefit from acquiring information about drug use. Appreciates and understands the enormous national security challenges posed by illicit drug trafficking on its nationals and that of member states. Ghana would therefore continue to work closely with other member states in protecting our borders, citizens, and more importantly, our youth, who are our human capital. I would like to take this opportunity to urge everyone in West Africa, and by extension, the African continent, to take the issue of illicit drug abuse and its related vices very seriously. As partners in addressing the global drug addiction problem, this occasion will also serve to encourage member states to routinely report on their country's drug situation as required by the ECOWAS Regional Drug Action Plan. As the report seeks to highlight the most recent estimates and trends in drug abuse and drug supply, as well as trafficking in substandard, spurious, falsified, and counterfeit medical products in West Africa, I will urge member states to put policies in place to build, strengthen, and redefine the operations of all national drug law enforcement agencies to carry out their mandate effectively and impartially. I would like to reiterate that Ghana, through the Narcotics Control Commission, is committed to all relevant conventions and regulations aimed at combating the illicit drug use and trafficking. It is important that member states reaffirm their continuous collaboration with all existing key stakeholders, both within and outside the sub-region, aimed at tackling the illicit drug abuse trend, which is grossly affecting the youth across. Today's launch marks not only the dissemination of information, but also a call to action. As we delve into the findings of the report, let us collectively pledge to foster regional cooperation, share best practices, and implement evidence-based policies to create a safer and healthier West Africa. In conclusion, distinguished ladies and gentlemen, I extend my deepest gratitude to all those who have contributed to the fruition of this report, from the dedicated researchers to our invaluable partners. Together, let us forge ahead in the fight against illicit drug supply and usage, striving for a West Africa free from the scourge of narcotics. Thank you, and may our collective efforts lead to a brighter and drug-free future for our region. Long live Ghana, long live INACT, long live ECOWAS. Merci, obrigado. Thank you for your audience.
Before we for the lunch,
Avant qu'on ne continue pour le déjeuner, avant qu'on ne continue au niveau de lancement, autant pour moi, je vais encore parler de ces 3 points qu'il avait mentionnés. DJ a parlé d'un appel à l'action. Et le directeur également a mentionné qu'on ne doit pas laisser le rapport juste quelque part pour rassembler juste la poussière. On ne doit pas laisser le rapport quelque part juste pour rassembler la poussière. Donc, cette division que nous avons au niveau de la commission de la CEDEAO, nous disons que pendant que le rapport est sur le point d'être lancé, nous devons nous focaliser sur ce que nous pouvons faire avec ce rapport. Vous allez prendre ce rapport, vous ne regardez pas juste le grammaire ou bien le vocabulaire ou bien peu importe la beauté de ce rapport, mais vous allez aller dans le point nécessaire qui a été mis dans le rapport au niveau des recommandations et ce que nous pouvons faire. Et là, nous allons le faire.
The Director General has just talked about. Let's put it at the back of our mind that we cannot do it alone. So we should come together, and then the evidence-based approach, that we don't just act anyhow or from our feelings, but what. So having said that, I will yield the floor again to the Director General. He will line the 2 reports, and then we will pick them, come back, go into it, learn more about it, and then discuss it. Thank you so much. So Director General, I will allow you to continue. Sorry for cutting you and stopping you, but it's important I emphasize the point, the excellent point you've just made. Thank you.
Distinguished ladies and gentlemen, at this juncture, I have the singular honor to announce that the 2020-2022 West African Epidemiology Network on Drug Use WENDU report of statistics and trends on illicit drug supply and drug abuse, and the policy brief duly launched.
Thank you, DG. Please, can you put the WENDU report? We have seen the policy brief. We'll come back to the, where we want to look at the larger one, then. So let's see the WENDU report. So thank you so much. Good. Okay, so this is the 2020-2022 West African Epidemiology Network on Drug Use report, the English version. This report is going to be in 3 languages, the French, English, and then the Portuguese. So Director General, we are so grateful and we thank you for launching this report. And as you said, we are going to, do what the report is saying, not just read it. So at this juncture, having launched the report, we are going to make the report available, but I will, as the agenda shows, we will go into the presentation of it after we have gone. Okay, so we have some few. The reason why we are doing it this way is that the resource persons are online and some are in different parts of the world and they have specific timings. So 11:50, we will be here to go through the report again, into details. Meanwhile, we have a documentary that will be showing and to keep us as we go along and have our coffee break, and then we come back. We take the group picture. Oh, yeah, the group photograph first. So I think we should do that. We have the group photograph. We take our tea break. We come for the, so press, please don't go, wait for us. Let's do the overview of the findings and then the presentation of the policy brief before you leave us. So thank you so much. And let's have the documentary, and then we go for the photograph. At a point, if we can also get the photograph online, that would be great, but I don't know how to do it. I don't know, maybe me and BBC. So the young ones, you will show us how to do it. So let's have a break and then we come back. Thank you so much. Thank you.
Pringles, o sabor que agarra. Hello, please, could you make me co-host?
Non, non, non. En fait, dans leur tradition, c'est comme si un homme. Donc, la femme s'occupe de lui de A à Z. Une mère a de combien tu ne touches pas. C'est comme ça. Non, papa, le mari essaie de toute la famille pour qu'on s'en occupe de toi ton départ. C'est comme ça, c'est dans l'accueil de la tradition. Mais après, comme si tu es un homme d'honneur, tu ne touches rien. Vraiment. Tu ne touches pas. Oh. Voilà, c'est comme ça. Et même dans leur tradition, maintenant, souvent, en réalité, il y a toujours des réactions qui vont suivre. Ça, c'est clair. Quand vous regardez dans les lois de Ségou, là, ils ont montré ça. Quand il est venu, un étranger, on lui a cédé, combien de maintenant, il a profité de la femme. Mais le lendemain, quand il est dans la branche, il a eu un hydrocèle. Oui, hydrocèle qu'il ne peut plus gérer. Et dès qu'on le voit, on lui dit qu'il a touché aux fruits interdits. Il a touché aux fruits interdits et tout le monde le reconnaît. Et tout le monde le reconnaît dans la région. Dès qu'il a touché aux fruits interdits, il a touché aux fruits interdits. C'est comme ça. Et même quand il a voulu, elle lui a dit, fais attention aux conséquences qui vont suivre. Tu es l'hôte de mon mari. Il a insisté. Et la femme, si la personne, c'est comme ça aussi, elle ne doit pas frustrer l'autre de son mari aussi. Mais malheureusement, qu'ils s'attendent à des conséquences. Ça, c'est toujours comme ça. Il n'y a pas tout ça. Madame, ils sont toujours traditionnalistes. Oui. Oh, il y a la différence entre la grand-mère, la tante, la maman, le type de bijoux. C'est soumission.
On va augmenter au gari là, non? Gari.
Pour le manger là, c'est tout le monde autour de la table. Pour
Yeah. Oui.
Oh, c'est ça.
Maman, prends l'argent.
Mais quelle que soit leur modalité, avec le même point. Allah
What did he say she sent? All the 15 countries in West Africa, plus Mauritania, are under siege from drugs. It is an old problem with new and increasingly complex dimensions. The drug menace has reached a new high.
We got to the point where the drugs started actually not being transported out of West Africa and started spreading in our different countries.
Donc, elle existe en Guinée, elle se trouve à proximité de tous les ménages et elle est très accessible aux jeunes et à la population. Et nous avons peu de structures de prise en charge et nous avons peu de personnel qui sont spécialisés dans le domaine de prise en charge. Et il se trouve que maintenant, au point de vue ampleur, le pays est envahi de drogue. Et puis, les problèmes sont situés à plusieurs niveaux.
The drugs of choice and substances abused have now gone from marijuana, heroin and cocaine to exotic pills, sundry cheap substances, tramadol and codeine.
Since 2012, when the first clandestine methamphetamine lab was discovered in Lagos, we have discovered about 15 of such labs. In 4 states in Nigeria, one of such labs was described by UNODC as a mega lab.
There is a new trend of abuse of substance we call kush. Kush is a combination of marijuana and other local herbs that are put together just to make people feel high.
There's one they call Coca Light. I don't know if you've heard of that now. They mix drugs, put it in coke, you understand? And these youths consume these drugs as though they're just taking a soft drink.
The direct and collateral cost to the West African community has been huge.
We decided that it was time to intervene and make sure that there's that the trade is stopped, not only stopped, but that the people who are on drugs are rehabilitated, which is extremely important for the social fabric of West Africa.
The Economic Community of West African States, ECOWAS, came up with a project to lead a sustained coordinated response
Okay, welcome back, and thank you. We want to go ahead and do the presentations quickly so that the press can, so that we can finish. The press should be with us. I was going to say that so that they can leave, but if I say that, it means, no, all of you, you stay here, let's all finish it together. Okay, so we will, if Dr. Ebiti, can you hear us? If you can hear us, let's see your face and then you start the presentation. Dr. Ebiti is the person who compiled the report. He is not physically with us here, and he agreed to present online. Oh, Dr. Ebiti, can you hear me?
Very well.
Oh, good, good, good. So I will just yield the floor to you and you go ahead and do the presentation. I was just saying that you have agreed to join us and do the presentation. Thank you so much. Okay.
All right. Thank you very much, Daniel. I hope that you are seeing my slides. Is that okay?
As we see, it's okay.
Okay. All right, thank you very much. So this is more of a snapshot. My name is Nkereweme Biti. The report was actually prepared by Dosu Komlan Galbat and myself. It's a snapshot of the 2020 to 2022 WENDU report. And basically the presentation will quickly go through a background for why the WENDU report is actually quite very important for us to track. We'll look at the objectives of this report, and then the methodology that was used to prepare the WENDU report, the key findings of this report, the implication of the WENDU report, especially to policymakers and the member state, the possible challenges that may have gone on with regards to this report, and then a few recommendations, and then conclusion. Now, first of all, the background of the report. It's interesting for us to note that there is a projection that by 2030, Africa will have the largest leap and increase in substance use in the entire world. Presently now, Asia is leading with drug use prevalence, and Africa will be leading just in the next couple of years, in less than 7 years to come, and they have the largest increase in substance use in the region. There are several reasons that have been put to that, but more importantly, if we come to West Africa and Mauritania, we found out that West Africa has 30% of the population of the entirety of Africa. Now, why is it important for us to note that? It's important for us to note this because West Africa itself has 56% of drug users in Africa, even though West Africa has a population of only 30% of the whole of Africa. And it is projected that between 2018, with about 165 million people in extreme poverty in West Africa, that number is going to increase to 206 million by 2040. And one of the drivers for substance use disorders and problems is as a result of poverty. And this is what they are showing that will be happening in West Africa. If we also look at in terms of the drug market itself, West Africa is said to have the largest regional drug market in Africa. In fact, the drug market has been projected to more than double from 5.7 million users in 2018 to about 13 million by 2050. And illegal drug use, that is the prescription drugs like the opioids, is said to have tripled from 1.6 million in 1990 to 5.87 million in 2018. And if you look at that graph, you can see that the projection still continues to go up. And so we see that it is more in West Africa compared to the entirety of the other parts of Africa put together. So it becomes critically important that in West Africa, we should begin to track drug use prevalence and drug use disorders, including trafficking, because it's an emerging problem, with an economy that is actually struggling. So what is the objective of the report from 2020 to 2022? Now, first of all, the report aimed at identifying the prevalence and patterns of drug treatment demand, which was supposed to assist in possibly informing targeted public health interventions in each of the member states. The second objective of this report was to provide evidence-based insight that would guide development and implementation of policies. In each of the countries, we find that there are peculiar problems in each of the member states. And so the information that is provided should guide effective policy interventions in those countries. The third one was to assist in resource allocation and prioritization. Now, depending on what we see in each of the countries, the member state may decide to prioritize allocating resources. Should they have more resources towards law enforcement? Should they have more resources towards the health perspectives and public health-driven interventions and things like that? And then the report was also to help understand the drug trafficking trends that we see. Are we having new psychoactive substances, as it were? Is it more of an ATAs? Are they products like plants, or are they the ones that are brought in from outside the country? And then it was also to provide information on emerging threats and potential challenges such as the new psychoactive substances that I've talked about. And of course, the report should be used by member states to support the planning and development of treatment programs within each of the member states. So what was the methodology that was used? First of all, I mean, the study design was more of an observational studies because we're taking data from both treatment centers and law enforcement. And then this data was collected together, including the demographic data, data on drug supply, data on drug treatment demand, and then the data was now integrated together for a comprehensive analysis of both the supply and the demand reduction data. And then there was this temporal analysis where we examined temporal trends. Okay, so what happened in 2020? Is it different from what happened in 2021? Is it different from what happened in 2022? And then in some cases, there was a comparative analysis where we looked at in the different states, what was different in the different states and what took preeminence in the different states. And of course, there was the quantitative analysis that was done more like a descriptive analysis of what we saw in the report for this year. So what were the key findings that we got? First of all, the total amount of drugs that we seized in this period, in this 3-year period, was 157,000 tons, about 157,000 tons. Of course, cannabis remains the highest drugs that have been seized so far. 62% of the drug that we seized was actually cannabis. And there was even a rise in the seizures of cannabis, clearly, from 139 tons in 2020 to 892 tons. So that is multiple-fold increase, more than 5 times increase in the number of cannabis, in the amount of cannabis that was seized. And Niger and Cote d'Ivoire had an increase of 60% of cannabis within this period of time that we actually seized. In terms of opioids, the largest opioid that was seized in the region were actually pharmaceutical opioids, made up of mainly tramadol and codeine, with the highest heroin seizure being in Benin. And it constituted 59% of the total heroin that was seized in the region. Cocaine seizures was at 1.9% of the total seizures, and the highest seizure was in Senegal. Senegal accounted for 70% of the cocaine seizures within the region. When it comes to amphetamine and ATS, 96% of methamphetamine were actually seized from Benin Republic, while 72% of the overall ATS was actually seized in Senegal. Ephedrine, as we know, is a precursor for the manufacture of several drugs, and about 0.9 tons of it was seized. Of course, other substances were also seized, like benzodiazepine, barbiturates, and ketamine. In terms of the treatment data, the highest, still in the supply data, the highest number of arrests was reported in Nigeria. In this period of time, about 36,373 persons were actually arrested in Nigeria related to trafficking in drugs. I'm just wondering what the size of the Nigerian prison is to start with, to have this number of persons arrested, within this 3-year period. And Nigeria accounted for the highest number of women too that were arrested during this period within the member states. And some countries had a yearly increase in the number of arrests, like Gambia, Niger, and Nigeria. And incidentally, of course, both male and female were arrested, but we found out that in Mali, in 2021, no female was actually arrested for drug trafficking. In terms of treatment data, in most places, men significantly outweighed women who came into treatment. 1 in 7 persons who were accessing treatment was actually a child, and that's very concerning too. 1 in 9 persons, was as a result of cannabis, who required treatment for cannabis use disorder was a woman. And 1 in 5 persons accessing treatment for pharmaceutical opioid disorder is also a woman. Now, why this is critically important is because in many of the member states, they do not have enough spaces to really cater to the needs of women in treatment. And so this is important for us to note. In terms of alcohol, some countries had significant number of persons having to be treated for alcohol use disorder, like Senegal, Benin Republic, Togo, Burkina Faso, Cote d'Ivoire, and Mauritania. And of course, cannabis, 37.2% of people sought treatment for cannabis use disorder. And as for cocaine, Cote d'Ivoire accounted for about 78% of those who sought treatment for cocaine use disorder, in their treatment facilities. And then in terms of opioids, there were increasing use of opioids like tramadol in a couple of countries during this period of time. And that included Benin, Togo, Mali, Niger, Cape Verde, Senegal, Mauritania, and Ghana. And this seemed to be spreading because it was countries like Niger and Nigeria that were really known for so much tramadol use, but we could see that many other countries within the West African region are now having opioid use disorder related to tramadol. About 59% of individuals who use drugs use it by inhalation. Of course, mostly because of those who are using cannabis. And just 1.9% were using drugs by injection. Well, even though it's 1.9% is very critical because of the problems associated with injecting drug use, including overdose, HIV, hepatitis, and several other problems that these individuals may have. Now, 65% of the individuals in treatment were between the ages of 15 and 34. Now, this is the productive years of individuals, so the young adults in the region were the ones that were mostly affected by substance use. And about 77% of those who access treatment through referral, access treatment through either them referring themselves or their families or friends, they were the ones that referred them. And about 60% of individuals who were seeking treatment were students. So that tells us about the point. They go into treatment for 3 or 4 months, it truncates their educational, their education. And about 23% of them were actually unemployed. 76% of them were single, 53% of them had not even completed their secondary school, and 35% of them have never even attended primary school at all. So we could see that to a great extent, they may not be able to continue their education because of substance use issues and problems. And a very large number of them, about 95% of them, they paid for their treatment by their friends or families. They were the ones that paid for them. So most treatments were actually out of pocket, and almost all the people that came in for treatment received it in urban areas, in the towns, maybe more because that is where they have these facilities. So that's also something of concern, that most rural places do not have facilities for treatment of people who have substance use disorders across the member states in the region. So what are the implications of this finding that we saw in the 2020 to 2022 report? Now, the first implication is that of policy. It's important for us to note that member states may need to develop strategies that will regulate and monitor pharmaceutical opioids in order to mitigate the possible misuse and then the diversion of this product. We saw, for example, tramadol and codeine. These are pharmaceutical opioids that are being diverted and they are being abused, and people are having issues with it. And so one of the policy direction is for member states to think about what they can do to really roll back such diversion. And there may also be need for member states to address the root causes of increased seizures and drug trafficking arrests. That's a big issue. Some countries are beginning to look at the possibility of alternative to incarceration. We hope that other member states may follow suit. I know that Nigeria has already started that process. Training is going on. So these can be issues to deal with some of the misdemeanors and minor offenses regarding people who are actually using drugs. The second implication that we would like to discuss is about treatment access and planning. There is a need for member states to see the possibility of allocating resources to accommodate, individuals who have substance use disorder. The reason is because almost everyone who were treated, except for 1 or 2 countries, like Senegal, if I'm correct, please, who had free treatment for people were out-of-pocket expenses. And because of these out-of-pocket expenses, many people may not be able to afford treatment. And so countries may begin to think about the possibility of community and low threshold kind of services that will make it easier for people to afford treatment to be treated. The other thing to look at in terms of treatment access is to tailor treatment programs to the needs of young person. We saw that young people are involved. 1 in 9 persons who was using drug was a child. And so if we look at all that, then we may need to begin to think about programs that target this young person and we'll be able to assist them to deal with the difficulties that they're having with substance use. Now, the next implication is with regards to prevention strategies. Of course, as much as we are gathering data on treatment, there is a need to also target prevention programs that would deal with, for example, the risks associated with pharmaceutical opioids. People are overdosing in some of the member states using pharmaceutical opioids such as tramadol. And so there's a necessity to begin to think about prevention programs really targeting this group. The other implication would be community support and involvement. Since we have a lot of support coming from family and from friends, it will be good to think about how do we leverage on these kinds of support to assist individuals into treatment, and of course, improving and increasing community-based kinds of interventions to enhance care for people with substance use problem in the member states. The other implication is that of referral mechanisms. It may be good to begin to explore some of the contributory factors of why people would have to be the one that will refer themselves, and how can we improve on that? How can we strengthen the collaboration between law enforcement, who in most cases are the first contact with people with substance use disorder, because it is either they get into trouble, they have committed a crime and all that. How do we leverage on such collaboration to improve access to care and treatment? And the other implication would have to do with financial assistance and affordability. We know that it may be good to develop policies and financial assistance programs that would assist and make treatment a lot more affordable for people who have substance use problems within the member states. Then another implication of the 2020 to 2022 report is the need to involve stakeholders in a collaborative effort to address the multifaceted challenges. There are a lot of challenges, and we ask ourselves, why is there so much trafficking within the region? And why is substance use increasing so much within the region? And why would there be associated crime even with that? So there's a need to pull all the stakeholders together to find an integrated solution and problem to substance use issues and trafficking within the region. And of course, there is a need for adequate public awareness, disseminating information on the kind of treatment that we have available in the region, encouraging early intervention, having workplace kinds of intervention, school-based kinds of intervention, to be able to help the young ones within the region, because we know that the problem is actually a huge one. So what are the challenges that we had in this report? One of the challenges was the issue of data heterogeneity. I mean, there were very data collection methods that was used by member states. And sometimes we did have challenges integrating this heterogeneous kind of data and making meaning out of it to be able to speak to one thing. And another issue was that of data availability and accessibility. There was, in some places, there were limited data availability. And so in some regions and some countries, the data they provided was not comprehensive enough. And so we feel that we missed out of some of the data that we have used to speak to the reports within the region. Another challenge was that of limited resources. We need funding. Many of the people that we train for data collection and related responsibilities had to move. Maybe they were transferred and things of that nature. More staff needed to be trained. And so there's a need for these kind of resources to be able to do it, because they impede the collation and analysis of data within the member state. And so the data that may be coming to ECOWAS may come in bits, some of them may not come, and they'll be missing data. And then, of course, incomplete coverage. Some data may not be coming from some region as a result of maybe lack of technology, lack of support in those regions. And so we are not really getting the entire data within the West African region. And so there are gaps in our data set. And so this does not give us complete insight into the trend within the West African region. So what are our recommendations? Just a few of them. One of it is that there may be need, or there is a need for us to standardize our data collection protocol. And hopefully all the countries will be using the exact same template in gathering data. In doing that, we are sure to get all the data that we need in one format, and it will be easier to integrate the data and do analysis. Two is the issue of capacity building. There is a need to increase capacity building. New people are taking up roles, and they need to be trained on how best to gather the data, how to collate the data, and how to transfer the data. There's a necessity for that. There's also a need to harmonize the reporting standards, so that once we get the data from each of the member states, we just put the data into a template, and each of the states will be able to speak to the other one because of the harmonization that is being used. We do need to use technology at this time. I mean, in those areas that are hard to reach, it may be easier for us to have real-time data. The use of technology would enable ECOWAS to get data on a quarterly basis rather than on a yearly basis. And so if from next year, the member states are sending data to ECOWAS on a quarterly basis, maybe technology will make that easier for them, because they can easily collate the result, impute it into a template, and just send it to ECOWAS. It becomes easier for ECOWAS to track what the trend is within the West African region. And the last recommendation that we wanted to put forward is the need for quality assurance framework. And this would help us to continue to improve within the region. There is no doubt that the reports from the member states have improved tremendously from the West African and Mauritania over the years. A quality assurance framework will ensure that that definitely is done. This quality assurance framework could also get to the point of the kind of treatment that is offered. ECOWAS have trained some of the member states on quality assurance, and that can greatly improve the outcome of the interventions that is carried out within the region. So what's our conclusion? We'll conclude by saying that the 2020 to 2022 WENDU report really underscores the collective commitment and determination of member states to address the complexities of substance use. I mean, there is no doubt. Right from its inception, everyone's hand is on the deck. They're doing their best to ensure that ECOWAS has the kind of information that they need to be able to publish this report. So we can say that this report provides a way for ongoing improvements, collaboration, and a steadfast dedication to creating an impactful solution for the well-being of our community. And so we want to use this opportunity to thank ECOWAS for the opportunity that was provided to us to be able to make input into the data, collate, analyze, and be able to present this data. So we thank you all for listening. Thank you.
Thank you very much, Dr. Ebiti. That's a very good presentation, very professional, and you went straight. So I will call Dr. Ani to add the policy brief so that we can discuss all together. So this is the report, and out of the report, we have the policy brief. So we'll go straight to the policy brief, and then when we come back, we have the two documents and we discuss it. Thank you very much. So, Dr. Eni, let me invite you, even though you are just sitting close to me.
Yeah, thank you very much, Amakwa. Serge, can you? Yes, please. So I'd like to thank Dr. Ebiti. One of the key things that we did was to go thoroughly through the report and then to draw out some of the policy relevance. I think he has already highlighted a key number of them already, but what we did was then to kind of put a magnifying lens on each of the policy brief to kind of see what the implication holds, especially for different set of actors at the regional level, at the civil society level, and also with international partners. So I will wait for the slide to come on.